Let's do a slideshow. Sorry, everybody. Slideshow setup. Is that there? Boom. Okay. Hopefully you can see a slide of a person hiking up a trail with no skin on their thigh. I didn't even skin this one. That was the book. So, what do you suppose the main action is of the lateral hip rotators? Anybody? I see a lot of people mouthing stuff.
Lateral rotation of the hip?
Yeah, lateral rotation of the hip, thank you. And what we're going to find out that's quite simple on them, I'm pretty sure if my memory served me correctly, I guarantee all 6 laterally rotate your hip, that's for sure. I think 5 of them only laterally rotate your hip. The piriformis is the only one that does 2 things. It laterally rotates your hip, and it's up so high that it can actually help with a little bit of an abduction. And let me explain that to you really quickly. So if these are hips here, which they are, you've got all these lateral hip rotators back here that we're going to find they all grab on essentially to the greater trochanter. They all essentially come from over here and grab on here. So when they grab this, they can actually cause your hips to rotate out. That's how they laterally rotate you. I can't move this because it's not really a true ball and socket, but if it was, it is a true ball and socket in your body. I meant this model. So they're in back and they laterally rotate. Well, the piriformis is the highest one up. It's the most superior, and because it's so high up, it actually grabs on the top here, and yes, it can laterally rotate it, but it can also pull on the top here, and when you pull on the top here, the leg wants to go out to the side. It wants to go out this way. So the piriformis can actually help with a little bit of an abduction. The only reason I point that out is that can help you in determining if the piriformis is pinching on somebody. So one of the things you can do, and this is not a proof positive test, so somebody can take this test and have no pain from it, and they still have a problem with their piriformis. But if you just ask them to abduct their leg and they get a deep pain back in here in their bottom, it's because they're using their piriformis and it's probably pinching on their sciatic nerve even more. And it just gives you, it's not a test proof positive, but it gives you an idea that, like, yeah, maybe the piriformis really is pinching on the sciatic nerve, because that's what it's known for. Cool? So let's go to these lovely, lovely muscles. All right. Okay. So who can tell me what muscle the lateral hip rotators are found underneath? Where do you find these guys? What muscle are they found underneath?
Glutes.
Yes, whoever said that, it is the glutes.
Sorry.
Yeah, thank you, Mr. Tate, sorry. So, yes, they're found underneath the glutes, all of them in a way, but definitely gluteus maximus and medius that they're found underneath there, right? So when you guys are doing your glute work, you've already been doing this, you're way ahead of me, but you loosen up the gluteals on top to get down underneath to these little lateral hip rotators, right? Okay, and who can tell me which is the most, and you can see it in the picture here too, which is the most superior of the lateral hip rotators, or the deep 6, as many people refer to them? Yes, Mr. Blygen, sir.
Piriformis.
The piriformis is the most superior. Who can tell me which one of the deep 6 is usually touted as possibly pinching the sciatic nerve and causing sciatica?
The piriformis.
The piriformis, that's exactly right. Cool. All right. So we see the piriformis here. Do we all remember how to find the piriformis?
The T.
That is right. I'm about to do it for you right here.
So if my memory serves correct, it goes along the edge of the sacrum?
Your memory serves you exactly correct, sir. It's very hard to tell here, but if you find the edge of somebody's sacrum, remember sacrum is an upside down triangle. And if you find the edge of the sacrum, which you can find in everybody very easily, and then you find the greater trochanter, and this is the top of your T, this is your piriformis. I mean, this works really, really well. Like, you can nail it. You can go to somebody and kind of do that and line it all up, and you can poke right there, and they'll be like, oh yeah, that's my piriformis. They'll feel it. So yes, we use the T to find it, and it's the bottom part of the T. It's this part of the T the piriformis itself. Yes. By the way, I think other lateral hip rotators might pinch on the sciatic nerve. So, but I'm not filling in there usually just for one. I'm trying to loosen them all up. Can any, well, you can't really tell from this picture. Let's wait a second. Okay. Can anybody tell me what's essentially the most inferior of the deep 6 lateral hip rotators? That's correct, because I'm getting good at reading lips. Yes, Miss Estes.
The quadratus femoris.
Yes. What does that mean, quadratus femoris? There's 4 of them?
That's a good question.
It is. I wish I would have thought of it. Oh, I did. So.
Yeah.
Yeah. Anybody?
Quad.
Quad is 4. You are right. Thank you. But it didn't say quadriceps, because what does seps mean?
Heads.
Right. It said quadratus. So hold on 1 second. Mr. Riedel, you got an answer?
It's four-sided.
Yes. They mean quadratus like quadrilateral. I don't know if we all remember back in school, quadrilateral was like a square. It is a square, actually. A square is a quadrilateral, but we usually think of like rhomboids and things like that that are squished over squares. Those are quadrilaterals. You've got, we're going to learn about 3 quadratus muscles. You guys know 2. And they're not exactly, by the way, they're not square at all. They're kind of rectangular, if that. But what are the 2 quadratus muscles we know? Anybody? Hold on 1 second, sir. Miss Mejia, raise your hand. Miss Mejia, please, tell me.
The quadratus lumborum and the quadratus femoris.
Yeah, cool. Quadratus lumborum, which is part of what muscle group?
The abdominal.
Yes. And quadratus femoris, which is part of what muscle group?
The lateral hip rotators.
Yes, thank you. Later, by the way, for those of you that like to kind of read ahead, so to speak, much later, almost towards the end of the course, we will do forearms and hands. And you've got I got to think of it for a second. Hold on. You've got a pronator quadratus. Oh, gosh. You've got a quadratus in your wrist. I'm trying to remember the name of it. Quadratus something that helps you pronate. Hold on. Pronator teres and pronator quadratus. So it's called pronator quadratus. That we will later learn in our wrist. So anyway, that'll be your 3rd one. And it's roughly a rectangular thing. It looks like a little bracelet under here that kind of hooks in here. It helps me flip my bones over one another in my hand. Okay, cool. Does anybody remember which of the deep 6, which 2 are most palpatable? Yes, Mr. Blygen, sir.
The piriformis and the quadratus femoris.
Yes. So what does palpatable mean, sir?
Easy to access.
Yeah, touchable, feelable. Yeah, palpatable, touchable, feelable, all that kind of stuff. Those are the easiest to find. So ironically, the one that's the most superior and the one that's the most inferior, piriformis, quadratus femoris, are also the most easy to find and actually rub. The other 4 that live in here, gemellus superior, gemellus inferior, obturator internus, obturator externus, you can feel them as a group. I have a very hard time feeling them, differentiating them for each other. It just feels like a bundle of stuff in here to me. It's hard. It's even hard to feel these 2, but it's a lot easier. But the good news is the easiest ones to feel are kind of the top and bottom, and then you know everything else in the middle is important too. Yes, Mr. Blygen, sir.
So with regard to the sciatic nerve, when we're working on the glutes, is it hard to, well, I won't say hard to hit it, but how do we avoid hitting it or making sure that we don't pinch it while we're working the glutes area, since it looks kind of like right on top?
Yeah, and it does happen, by the way. So you've hit on a really important thing, and it happens enough that some people are I think they're overly cautious. in the gluteal area because they're so worried about hitting the sciatic nerve. By the way, rest assured, if you hit it, you won't actually cause any real damage. I mean, unless you take a running leap and drive your, do some kind of pro wrestler move. But if you put your elbow in there, rest assured you won't cause permanent damage, but you'll know when you hit it because your client will scream and jump off the table. It's very noticeable. It's not like you'll leave them any lasting pain, but they'll be like, whoa, what was that? I mean, you'll get a real reaction. Sir, there's not a really great answer to this. The way I do it is I'm very careful when I drive an elbow in there. Like, I always go slow into the glutes. Not with my fist, I'm not worried about that, but when I use fingers or elbows and I'm going in pokey, you've got to go slow. If you guys are doing these big forearm moves you're fine. But what happens is after you kind of loosen up the glutes, sometimes what I'll do is lift up my arm a little bit so that I drive in with this. And sir, what I try to think about is actually tracing down the piriformis, kind of dragging across it instead of just stabbing in there blindly. And you go in slowly, and usually when you go in slowly, the nerve moves out of your way. Because I'm not able to feel the nerve. Now maybe some massage therapists are, but I can't. But I try to feel for the piriformis and things like that, and that's been very successful for me. And as long as I go slow, I haven't had a problem with it.
Because in this picture here, that all the meat and all the muscles from the gluteal muscles are moved out of the way, in relation to where the sciatic nerve, which muscle is over that one? Is that the gluteus maximus?
Yes, that's gluteus maximus.
Okay.
Yeah, and that's essentially, some people call it the gene pocket. That's essentially where your genes would be. Actually, they're a little higher, your gene pocket. But anyway, right underneath the gluteus maximus, and you're right, if you hit it kind of dead center, one cheek, I know that's improper, but one side of the gluteus maximus, if you hit it kind of dead center, you'll usually hit the sciatic nerve if you go driving straight in. But the thing is this, I'm not exactly trying to avoid it. I'm not trying to rub it at all. I don't want to hit the nerve. But the nerve is probably entrapped. By the way, on some human beings, it doesn't run under their piriformis, just so you know, it runs through it. Yes, thank you for the surprised look. So in some human beings, it actually runs through it. This doesn't kill them or anything like that, but it makes it even more prone for them to develop sciatica. So I'm actually trying to get in there and kind of stir all that up. I'm trying to rub that stuff because I'm trying to open up the very tissue that it's lodged within. Yeah.
So if their gluteus maximus muscle is like thick enough, and it's on top of it, it kind of lowers the chances of us hitting it while we're working on it.
Yes. Yes, the gluteus maximus, do you mean provides padding, so to speak?
Yes.
Absolutely. In fact, I don't think on a normal person that didn't have horrible pain down there, I think it'd be very hard for you to hit it in a way that would bother them unless you were using a sharp thing. You could do it with your fingertip even, but if you're using like forearms and fists, I don't think you're going to affect it at all. Another trick I use is lots of pinning and stretching in this area, right? Because you can move the leg back and forth because I want to drag the lateral hip rotators underneath my hand. And that way, I'm less likely to hit the nerve, and I've got stuff pulling underneath my hand. I'm trying to get it to rub and massage itself, if that makes sense. Yeah, and you guys do that already when you're doing glutes, and you do that because the gluteus maximus is a lateral hip rotator also, but so are these little guys. You gonna say something, Mr. Blygen? Okay, you got it. So be careful, but do not avoid this area, and get in there. Just go in slow. It gives a chance for the nerve to kind of move out of the way and all that kind of stuff. Yeah. By the way, Mr. Blygen, if you have to avoid it, like you do not want to touch that thing, you've got a hypersensitive client, then you do what I call the big C and the little c. You make sure that you make sure that you take your elbow just around the greater trochanter and way up high here. If you go around the hip and trace like below the crest of the ilium and the edge of the sacrum here, and then you go just around the head of the greater trochanter, which is like a C here and a big C here, you won't hit the sciatic at all, and you'll hit all the origins and insertions essentially. And that will allow you to avoid it completely. But I kind of like to get in the center there and kind of tear it up a little bit. But I'm a little crazy like that. Yeah. Yeah. And I find people that have sciatica kind of like you to get in there. Kind of work it out. Okay. So, let's see. Miss Vincent, what are the 6 lateral hip rotator muscles?
Piriformis, the gemellis superior, gemellis inferior, quadratus femoris, obturator internus, obturator externus.
Cool. Which one is most superior?
Piriformis,
Which one is most inferior?
quadratus femoris.
Which 2 are most easily palpatable?
Both of those, piriformis and quadratus femoris.
Thank you. Which one is most likely to pinch the sciatic nerve?
Piriformis.
Yes. Awesome. Thank you. By the way, we can also see that the obturator internus here runs under the sciatic nerve, and it could be another culprit too. Piriformis is more likely, by the way, but still. Cool. Excellent. Excellent, excellent, excellent. Let's look at what these muscles do. Remember, I said they all laterally rotate your femur, your hip, because they're behind you and they grab onto it. But the piriformis is so superior that it grabs onto the top of the greater trochanter. Can you see that in this picture? And that means because it grabs on the top, it actually can act a little bit like, kind of like a deltoid there, and lift out my hip. Right? I realize my deltoid is my shoulder, but the same concept. There's another interesting fact here. This is what I do like about origin insertions. Origin insertions can get a little bit heady, but there's some neat information about them that can make you a better massage therapist. What is the origin, it's right here on the slide, of the piriformis? Anybody? Read it to me. Yes, Miss Mejia.
It's saying the anterior surface of the sacrum, but you would think it would be the posterior surface because it's in back.
Thank you. Thank you for saying everything I was thinking. Yeah. This is the posterior surface of the sacrum. You'd think it would attach right here. It actually goes underneath here a little bit and attaches kind of like my hand is doing right now. So it's actually in front. Now, can we massage this attachment from the front? Can we reach in through here? And wouldn't advise it for all sorts of reasons, right? Right. So the reason I'm telling you this is kind of cool is when I'm taking an elbow here, I'm not just thinking about etching around your sacrum. I'm thinking about going under your sacrum. Even try it with your thumbs someday, guys. Just not thumbs. I don't like you to overuse thumbs, but the point is, I want you to, don't just, right now you might be pushing down around a sacrum to kind of etch it out. Miss Carodi, I was kind of doing this to her today. I was taking my elbow and going boom, 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 boom. But actually come from the side and find this edge and try to work under it. You're not going to, you're only going to get under it that much, but you're going to get a major, major release on the piriformis. So don't be afraid to actually look, pretend like you're trying to get under the sacrum. These are small differences that will make you a dramatically better massage therapist. Yeah. And then it inserts into the superior aspect of the greater trochanter, which just means what? The top of the greater trochanter. Cool. The quadratus femoris, which is the most inferior muscle, also essentially inserts into the greater trochanter, but it inserts into something called the intertrochanteric crest, because it's kind of a wide muscle, so it grabs a whole crest. What does intertrochanteric mean? Mr. Blanchard.
So I'm just breaking down the word. Inter, I would say like maybe in between.
Yeah, yeah, thank you, sir. Inter does not mean enter, does not mean to go in. It means between, like interstate transport, right? Interstate transport is usually a trucker or drug dealer that's transporting stuff across state lines. Interstate transport. So inter means between, so this is a crest between the trochanters. Well, We're all very familiar with the greater trochanter. You can feel it on your hip right now. That's this bump on your hip, right? These are your hip bones, and down here, that's this bump. What we don't realize is there's this bump, your greater trochanter, but there's a lesser trochanter here. We will never feel it in our lives because from the front, it's covered up by all your adductors. You'd have to go through this much I think you'd kill somebody. You'd have to go through 5 inches of adductor. I don't care what size they are. But these two trochanters create a crest, and it hooks onto the crest. To me, it's still the greater trochanter, but it's the crest between the trochanters. That's what intertrochanteric crest means. And in the slide, you can see the lesser trochanter down here. Greater trochanter, lesser trochanter, crest between the two. It also has an origin on the ischial tuberosity. What other muscles have an origin on the ischial tuberosity? They're lower down, they're down here, but they like to grab onto them big loops on the back. Yes, Mr. Blygen, sir, please.
The hamstrings?
Yes, yes. These, if you think about it, these are big loops for muscles to grab onto, and the hamstrings grab on back here. So this is why I tell you guys to like to run your elbow all the way up until you hit the sits bones, which is the ischial tuberosity, because there's so much important stuff and so much fascia hooked on back there. Cool. All right. But anyway, the piriformis is the only one that has more than one action than laterally rotating. They all laterally rotate. Piriformis is high enough up that can also abduct. Quadratus femoris. Obturator internus and externus. Let's talk about why these are called what they are. This is hard to see, but this is the anterior view of a hip, right? Underneath here, you've got these sits bones. We've talked about them. This is the posterior view. There is a hole in here, and there is a hole here. Now, in your bodies, by the way, this hole is covered with a very thick membrane. This hole allows muscles to grab onto it. It allows also very important veins and arteries to go through, and then the membrane's kind of grown around them. So this hole is very important. Does anybody remember what we call a hole in the body? Yeah, foramen. So this is called the obturator foramen. So these muscles, the obturator externus and obturator internus, actually hook onto the membrane that goes around these holes. And if you think about it, this is kind of hard to picture, but I can get to this hole from the outside, and I can get to it from the inside. And the obturator internus, this is the backside of your body, literally hooks on the inside here and wraps around and comes here. It's very hard to see this from the picture because the picture is taking all this and making it three-dimensional. But it actually goes inside here, hooks onto the inside of this hole, and takes a 90-degree angle and goes over here. The externus grabs on the outside of the hole and goes over here. And that's why they're named that way. By the way, that won't change your life. It's not that you have to like fill each little one step, but I just want you to kind of understand the concept of why they're called obturator internus and externus. They both cover the obturator foramen, and one's on the outside and hooks over. The other one's on the inside and actually comes around and turns a corner. This picture is trying to show you that, but it's hard to see from the picture. But both of them are found between the piriformis and the quadratus femoris. They're both found in this little section. This whole thing we're talking about is about this big inside somebody's bottom. Muscle here, and 4 right in here. So that's obturator internus and externus. And gemellus superior and gemellus inferior. Remember, gemellus superior, some of you on your homework, it's not the most superior of the lateral hip rotators. It's just the most superior one named gemellus. Gemellus superior is above gemellus inferior, but that's it. That's where it ends. Just like adductor longus in your inner thigh is not the longest adductor. It's just the longest one named adductor. The gracilis is actually longer. So anyway, gemellus superior and gemellus inferior are also found are also found between those little spots right there, and they both laterally rotate. Yeah. Cool. And they both, by the way, essentially insert into the greater trochanter too, right? But they insert to the inside of it. Your greater trochanter is so big, that from the back side, it's actually got an inside here. This big head, you can actually grab on inside there and hook stuff inside. And that's what they mean. By the medial surface, this would be the lateral surface. This is the medial surface of the greater trochanter, and it hooks in here, right? But for our purposes, all of these muscles essentially grab onto the greater trochanter, right? I don't need you to memorize every last little thing. All 6 essentially grab on the greater trochanter. The quadratus femoris grabs onto this intertrochanteric crest, which is a little bit lower, but they're all grabbing onto this sucker, right? Cool. And this is an important point. Remember my big C, little c? Big C is really good at getting things like the piriformis, because you go around the sacrum and underneath the hips. It's really good at getting the glutes too. That's what the big C is for. But it'll get the origin of the piriformis. No problem. Things like gemellus superior and inferior are really deep in there, and the only way to kind of hit them is by doing the little c around the greater trochanter. Start playing with that, everybody. Try to kind of peel muscle away from the greater trochanter. You're always trying to get muscle off bone. You'll never succeed, and nor do you want to, but you always have that feeling of, I'm trying to push muscle off bone. You're always trying to debone the turkey. Not that our clients are turkeys, but I just think of like Thanksgiving, trying to get the meat off the bone. Cool? All right. Okay. So, good stuff. Pretty easy stuff. Here's a picture of the T. Again. Boom, for the piriformis. How many people have had sciatic nerve, have had sciatica symptoms in this group, or know somebody who's had sciatic symptoms? Yeah, most people. It's super duper common. We think that sitting at a desk for a long period of time is not good for it. We think men that put or women, that put wallets in their back pocket is not good. It tends to push on that sciatic nerve over a long period of time. That's not good. We think general tension back there seems to affect it too. So it's a really common complaint. And the first place you'd go for sciatic problems are the glutes, underneath the glutes, the piriformis. That'd be your first thing. You would then, by the way, work up the back to the low back, because it might not actually be pinched down there. It might be a pinched nerve from the spine in the low back that's showing up as sciatic down further. Remember, like, if I call your cell phone and say fire, you don't know if I'm warning you about a fire at your place or if I'm telling you there's a fire at my place. And that's the same thing true with nerves. So I might have pain running down my leg. You don't know where that nerve is pinched. But a perfect guess would be first look in the glutes underneath the piriformis, but then also look at low back, because that can affect it too. And of course I would massage the entire leg too, just because it's achy from sciatica and all that stuff. This is a very good condition to stretch too. And do any type of stretch. Piriformis stretching is really good for this area, which is when you cross somebody's leg over them in a figure 4 and bend it up on them. It's very effective for piriformis stretching. Yeah. Okay, any questions about the deep 6 lateral hip rotators? Yes, Miss Lobitz, please.
So the piriformis actions, the abduction, it says it abducts the hip when the hip is flexed. So
Yeah.
it doesn't do it when it's extended?
Hold on, I think it does a little bit when it's extended, but I understand what they're saying. I'm going to unscrew this so I can show you why. I've got to get this ball and socket to actually work. All right. So here is your top of your femur. And if you have a muscle up here, you can see right now, I think, that if it pulled, it would kind of cause an abduction, right? But this muscle isn't exactly here. It's going underneath the sacrum. So from here, it doesn't have as good a pull. It's better at laterally rotating. So if this is the back side of you, it's better at laterally rotating right here. It'll laterally rotate. Well, if all of a sudden I flex my hip, now this lever's sticking way out and it's going to abduct even better. So it's that the lever changes when the hip flexes. It's kind of like you've got this thing like this and this little muscle on it. Well, when your hip flexes, all of a sudden this thing's way out here and it can flex even easier. It's just the piriformis is in a better angle. Yep. And by the way, that's the reason a figure 4 leg stretch stretches your piriformis. Otherwise it wouldn't. If your piriformis didn't do an abduction while in flexion, we wouldn't use that stretch, but it's highly effective because it does and it works perfectly. It really gets the piriformis. Yeah. And you guys, if you don't know what stretch I'm talking about, I'm literally just talking about like when somebody, I wonder if I can do it here. If I can put my leg up like this, and then I bend over towards it, my leg is now flexed, and me bending over actually starts to stretch the piriformis back here. I'm just putting in a figure 4, and I just lean over to it, or bring it up to the client. And that's a very effective piriformis stretch. And I love piriformis stretches. And you will get lots of people with sciatic. I mean, that's common. Any other questions? Did that answer your question, Ms. Lovitz? Good. Oh, Mr. Ibarra's got sciatica. So I think what he's really saying is that you guys can all practice these moves on him. And I think that's important. And what he's too shy to say is he really likes a really strong elbow, just really going in there and kind of exploring around stuff. Okay. Awesome. All right, any other questions? None so far? I super appreciate how engaged you all are. I find you all engaged, like you're really thinking and working with the material and stuff like that. But no matter what, the lectures are very dry until you take this kind of two-dimensional information from a flat page and try it out on a body. So please keep playing around in lab, right? I love when I walk in and people are like, I don't know what I'm doing, but I'm, trying stuff. So play with feet, play with hips, play with hands, play with shoulders. I promise you that you, and many of you have already done this, you will invent your own moves. And they won't just be kind of like, they'll be great moves that I could have never taught you because and they'll work just really well with your body and your understanding of something. And the only way you invent those moves is to play. So please keep exploring. I 100%, I actually guarantee I could leave right now if I locked you guys in a room and just came back a month later and you just explored the whole time, you'd leave very good massage therapists. That's what makes a good massage therapist. Is just messing around and going like, what happens when I do this? And put my finger up my nose like that and pull the head over like that and just do it. Cool? All right. If there's no other questions, I'm going to release homework. There are 3 pieces of homework, but I'm very delighted to say they are small. Let's see. You have an 18 question. Oh, hold on. My computer just froze here. Hold on one second. You have an 18 question test on the deep 6. Here we go. You have matching from chapter 11. Tomorrow we're going to be talking about special populations. I don't know if I even like this determination, but special population, everybody should be a special population. That's what I'm going to tell you tomorrow. But special populations is things like my client's pregnant, or my client has something that makes them a little bit unique. But I kind of feel like that's everybody. But we will talk about that. That's chapter 11. So you got matching from chapter 11. And I thought you had a TED Talk in here that we already had queued up. Bear with me. I will check. Maybe I'm wrong. I think. Yes. And you have, got it. You have The Power of Vulnerability, which is Brene Brown. We have not listened to that yet, right? That's correct. That's what's supposed to be queued up now. I just want to make sure we didn't do it in the last course.
Mr. Topso?
Yeah.
So there's, I did Power of Vulnerability yesterday.
I know. I don't know how it got released already, but you're fine, sir.
There were 2 more though that I didn't. That were
No,
due
none
today.
of them were supposed to be released. What happened was Well, what happened was I screwed up. But what happened was, we copy courses over from an old one, and I just forgot to turn those off, so to speak. And you were very diligent. You jumped in. So you are ahead, sir. But don't worry about the other ones. Don't worry about anything. Just 3 things, everybody. Let me be really clear. Really. 1, we'll say number 52, test on TG6 pelvis thigh deep 6. It's an 18-question test on the lateral hip rotators. The other one will be 53, matching MT11 special populations. That's the chapter questions from chapter 11 of your massage therapy book. And the last one will be a discussion. It'll be under discussions. And there are a couple lit up there. I couldn't turn them off now. It's a long story. But we are looking for the power of vulnerability, Brene Brown 1. And that is that. That's it. And I'll be around. I'm going to be arranging furniture in the classroom, so I'll be here if you don't see me. I'm here. Yes, sir.
So let me just double check.
Please, sir.
So the other 2, the why your critics aren't the ones who count by Renee Brown. And,
Yeah.
The other one, Donald Hoffman's.
Yeah.
You see the reality as it is.
Yeah. No, they're not. I mean, we'll do them later, sir, probably, but they're not. They just, and the reason, once they're opened, I can't close them. Otherwise, I'd close them.
Okay.
Because they're confusing.
Right.
But yes, please ignore those, sir.
Okay.
Sorry, Mr. Tapscott, which TED Talk did you say it was? I trailed off while you guys were talking.
No, it's totally okay. It is the power of vulnerability, Brene Brown 1.
Okay, thank you.